Good morning, everybody. I'm Stephanie Cummings. I'm the state representative for the 74th House District, Waterbury's East End and East Mountain. And today I have with me Dr. Michael Sims, who is the St. Mary's Hospital Director of Infectious Disease and Infection Protection. Good morning, Doctor. Thank you for being with us.
You're welcome. Good morning.
So, Doctor, as you know, we just started phase 2 of the Reopen Connecticut plan, and businesses are starting to get back to the new normal, as people are saying, and we're starting to open up, and we're seeing people going out into the community a little bit more. So I wanted to take a couple minutes to talk with you about how people can stay safe as we start reopening the state.
Okay. Yeah, it's very important that people understand that although we avoided potential catastrophe during the first wave that began in March through April and in May, the virus has not gone. It is still here. It is still just as deadly as it was when it first arrived. And it's very important that as we get to the new normal, that people continue to be vigilant and follow the guidelines in order to prevent infection. We need to get back to normal. We need to learn how to live with this virus until such a time comes we have a vaccine that's very, very effective and can be given to everyone, and or a cure for the virus, so we can go back to a bit more of a normal existence. But for now, the only defense we have against this virus are the CDC, IDSA, and NIH guidelines about social distancing, masking, hand hygiene, staying home if you're sick. It's very important people not underestimate the severity of this infection or the fact that we could go right back into another wave that could be at least as bad, if not worse, than the first one was, which would require a shutdown of society again. So we got through a very difficult 3 months. The best way to avoid that ever happening again is to remain vigilant and follow the guidelines.
Thank you very much. And Doctor, would you share a little bit of your background and your role at St. Mary's Hospital?
Yeah, my background is I'm an infectious disease specialist. So after completing my residency in internal medicine, I then did a fellowship in infectious diseases at Brown University and then came to Waterbury. I've been working in infectious diseases and been on the faculty at the hospital in the Department of Medicine since then. And now I am the most senior infectious disease doctor, but one of 4 who's here at the hospital. And my responsibilities include seeing patients with infections, answering consults from doctors about patients that they have concerns about infections in, doing things like travel medicine, infection prevention. My other colleagues are experts in the treatment of AIDS, HIV, and the treatment of chronic hepatitis. So we offer, all the services, internal medicine service for people with infections or prevention of infections as part of all the care that we would provide in the hospital.
Fantastic. Thank you for sharing that with us.
Welcome.
So my constituents and my colleagues have submitted some questions, some things that they are concerned about as the state is starting to open back up. My email going. One of the concerns is that teachers are a little concerned that well visits for some of the children may have been missed because people were concerned about going to their doctor's office or going to the hospitals to get the routine vaccines, mumps, measles. Do you have any concerns that we may see a mumps or measles or similar outbreak due to the lack of well visits?
Well, yeah, that's one of the difficulties we saw. One, because the health system was so consumed by the pandemic, many of the other healthcare interventions had to be postponed. So elective surgeries, well visits, we were able to replace a lot of the office visits with virtual visits, either audio or Zoom visits. But we still have not gotten back to everyone yet and gotten back to the level of care that we could have provided because we were really down for 3 months. We're still catching up with many of the procedures and elective surgeries that had to be postponed as well. So certainly there are going to be consequences of that until we can get everyone vaccinated, everyone seen, everyone back in contact with their doctors and making sure that to getting the optimal health care they can. So the faster we do that, the better. And yes, there'll probably be some consequences of that. Right now, we're still waiting for the statisticians to analyze the data to see if there was a measurable impact on the outcomes, on the quality of care of other medical conditions besides the coronavirus. Did we see more heart attacks, more strokes? Did we see more diabetics go out of control, more consequence of uncontrolled hypertension? Were there consequences to delaying elective surgical procedures or interventions? So we'll have to wait for that data to come out. There was also the mental health impact too. That's been very, very stressful. People have been locked up, sometimes with each other. And we're still, the behavioral health scientists are still looking at that, exactly what are the measurable consequences of that to the population as well.
Are there any steps that people can take to support better mental health just in their routine daily lives as we live with this virus and this disease?
I would turn to, there are a lot of resources online now. A lot of the people from the behavioral health community, psychiatrists, psychologists, social workers, addiction specialists, et cetera, have made an effort to reach out to people both in cyberspace as well as personally to tell people how to prevent behavioral health consequences of the shutdown and the anxiety produced by having a lethal disease strike the population, as well as now how to get help for those conditions, where to go, who to speak to, different modalities one can use for depression, anxiety, addiction, alcoholism, et cetera, that are consequences of this pandemic. So I would certainly reach out to those experts in that area to find out exactly what's the best way to prevent these problems, to deal with these problems if you have them, to get treatment from a competent professional if you're suffering from them.
Thank you. And parents are definitely concerned about their little ones because, you know, little children, everything, they touch everything, they put everything in their mouths. Is there anything that parents can be doing aside from just making sure that they're washing their kids' hands and if the child is old enough, wearing a mask to help make sure that there's no spread of the disease to these vulnerable children?
Yes. Yeah, parents need to do pretty much what they've always done to prevent infection in children, including, washing the toys, washing their hands, not picking up the food off the floor and putting it back in their mouth when they invariably throw all their food on the floor and put it in their mouth.
Always.
Having been a parent, still am a parent, I know exactly what kids do. The good news about that is that kids are built pretty rugged. Mother Nature built in a lot of safeguards. And the good news is, particularly with this virus, the little children, children in general, seem to fare better. Now, that doesn't mean they couldn't get sick. Many of them did. Some of them died. Some of them had unusual inflammatory reactions to this. But for the most part, children fared pretty well. And there's a lot of evidence that children getting exposed to a lot of microbes and antigens when they're younger probably helps them grow up to be healthier in the end. There's data that they may consequently have less in the way of things like eczema, asthma, autoimmune diseases. So I would continue to do the good parenting that people have done all along. Coronavirus is just one more germ that the kid is likely to put in their mouths. But the good news is they seem to do okay with it in general compared to the geriatric population or those with a lot of medical comorbidities.
Thank you. And should parents be concerned about that multisystem inflammatory MISC that we heard some news about?
Well, yes, it's another thing to be concerned about, but you have to understand it is very rare.
Okay.
And this is not the first time we've seen it. It was around when I was in medical school. It had a different name. It was called Kawasaki syndrome. It can be due to other things. So there's no guarantee if you don't get coronavirus, you'll never get this. It's a very, very rare complication. That's why it got so much attention, because it was unusual to see it. And it's just, unfortunately, one of the things that can happen to children that'll be very, very rare. There are lots of other things that kids can do. They can fall out of a tree and they can, get another infection, whatever, they can fall, all kinds of things can happen to kids. So parents need to worry about it, but I wouldn't be inordinately concerned about it. It's a very rare, very unusual complication of a very rare disease.
Okay.
So there are a lot of other things that parents need to worry about besides that.
Thank you. I know a lot of parents see things in the news, and especially new parents, and it causes concern because they want to do what's best for their children. So it is confidence inducing that it's a rare disease, and there's so many other things that parents have to be concerned about, but this is not one on high on the list.
No, not by any. Nope.
Thank you. We've heard a lot that the COVID-19 can live on surfaces, and now we're hearing reports that maybe that's not so true. Can you tell me what we could do with all of the things that we're touching as we go to the stores? So we have to be concerned about the disease living on these items.
Yeah, for the most part, it's spread by respiratory droplets. That's the main way. There are situations where it can be spread by aerosols, so it'll stay in the air longer. That's mostly something we have to deal with in a hospital when we do aerosol-producing procedures on patients. We have to take additional precautions for that. We do worry about surfaces because it can stay viable on surfaces for a period of time. So we include hand hygiene in our regimen of protection, and it would be wise for people to do the same. Get in the habit of washing your hands or doing hand hygiene when you're touching surfaces. That not only will help you with coronavirus, but remember there are many other pathogens out there as well you want to protect yourself against. So being in the habit of washing your hands, doing hand hygiene when you're touching surfaces, getting close to people is not a bad idea. If you're taking something from outside, wouldn't be a bad idea to kind of leave it for a while or even wash your hands after you've touched it. You would have to literally touch a surface that someone coughed or sneezed on within the time the virus is viable, which for some surfaces can be as much as a couple of days. But if you're cautious, you should be okay.
Okay. Now, we've all been wearing our masks diligently as we go back out into the world. How often should we have a cloth mask? Should people be washing those cloth masks or changing the disposable ones?
Really, the disposable ones are okay as long as they don't get wet.
Okay.
They get wet or they fail to function. The cloth masks, the cloth masks do some protection of you, but they're not as good as the surgical masks that people wear. Their main role, and they're very, very effective at it, is actually protecting you from expelling droplets towards others.
Okay.
But the idea is if everyone wears them, everyone is protecting everyone else in addition to somewhat protecting themselves. If you're going to have a serious exposure, like we do in the hospital, then you don't want to wear cloth masks. You want to wear the surgical mask. They actually have a layer in the mask that's actually electrostatic that actually will attract the virus and hold on to it. So they're more effective than just mechanically blocking the virus. So in that situation, then you want to go to a surgical mask. We don't wear cloth masks routinely when we're exposed to the virus in the hospital. But outside, if you compulsively wear cloth masks and clean them if they get dirty, dispose of the disposable ones if they get wet or soiled, you should be okay. And of course, maintain your distance.
Of course. Yep. The 6 feet is very, very crucial at this point in time. What about people wearing gloves? I see a lot of people that are touching things in the stores and then they get in their car and they're driving away with their gloves on and touching their phones. Can you explain a little bit about the purpose of wearing gloves and how to do it properly?
Yeah, we wear gloves in the hospital because we're going into environments so we know we're contaminated. Wearing gloves outside the hospital is really kind of above and beyond. You don't know you're necessarily touching a contaminated surface. I would recommend you'd be better off, rather than the gloves, better off just being compulsive about hand hygiene. So if you're touching something in a store or you're doing something and you're touching things, when you're done, don't touch your face. Go immediately wash your hands or do hand hygiene with alcohol rather than worry about the gloves. The other thing I worry about is people don't always dispose of the gloves properly, and somehow they think they're a shield. They have to realize that if you wear gloves and touch a contaminated surface, those gloves are contaminated. So if you then get in the car, grab your steering wheel, or you're touching your phone, you've now contaminated the steering wheel and the phone. You'd be better off not wearing gloves and making sure you do hand hygiene before you touch the steering wheel and the phone. That would go a longer way in preventing spread of virus than having on gloves and then touching everything with your contaminated gloves.
Thank you. I had a submission from a 78-year-old resident who used to very much enjoy meeting up with a friend for breakfast once a week. This gentleman is autoimmune compromised through cancer treatments and was wondering about the safety of being able to go back to that routine weekly breakfast with his friends. Any guidance?
Yes, everyone needs to look at their own unique situation and consider the risk of what they're doing. So that computation of risk, let's say for a healthy 25-year-old, would be very different than the person you're talking about. The consequence of getting the infection would be much different. There is a concept called the quarantine bubble that people can use in order to avoid infection, and it might be pertinent to your constituent who has the question, which is that if their friend has been compulsively quarantined, has not been exposed, and he himself has been compulsively quarantined, has not been exposed, then we consider it safe for them to get together, because even though they have been quarantined together, we consider each of them probably as little likely of having the virus. But still, I would recommend they still wear masks when they're talking to each other, stay 6 feet away, do hand hygiene. But obviously, if they're going to eat, I'd recommend they sit 6 feet away from each other, and they can eat. But if they've each compulsively maintained quarantine and haven't become infected or colonized themselves, it would be considered safe for them to get together and then follow those guidelines to prevent any potential spread of virus.
Thank you. And we've heard that there may be a vaccine on the horizon. Is there anything that we can anticipate coming forward with a vaccine to help prevent this?
Yes, I have every confidence, and so does most everyone in the medical community, there will be a vaccine. It will probably be available in unprecedented short period of time because the scientific community has pulled out all the stops, and they have developed techniques for developing the virus and getting it approved and getting it tested that really they've never done before. So they really should be commended for the effort they've put in. Unfortunately, it's still going to take a certain amount of time to develop a vaccine. If they develop this vaccine within 2 years, that will be historically unprecedented. But still, 2 years is a long time away. We still have to live with this virus. But if you consider that normally it would take a decade or more to do something like this, that's pretty good. But it's still 2 years that we have to learn to accommodate ourselves to this virus before we have the vaccine. The other thing you need to realize is even if we had a very effective vaccine today, we need to immunize the entire world in order to make us safe. So if this pandemic taught us anything, it's that what happens in a market in Wuhan has an impact on Waterbury.
How interconnected we are.
Exactly. So it's not enough that we have an effective vaccine and that, we all got the vaccine in Waterbury. We need to make sure everyone gets it. So it's going to take time, even when we have an effective vaccine, to immunize 6 billion plus people in the world to make sure we're all safe and the whole world is safe, and the risk of this being brought in from an epidemic somewhere is minimized. Realize that's not going to happen instantaneously. It will be rolled out in waves. The first group to get it will probably be people in healthcare so that they don't get sick and die when there's another pandemic. The next group will be our vulnerable patients to try to keep them from getting sick and dying, to lessen the load on the healthcare system and save their lives. And then we'll have to roll that out progressively to other groups. So anyone who's counting on a vaccine to put an end to this and think that, well, I don't have to take those precautions because they're going to immunize me like in the fall and this will all be over, realize that one, it's going to take a while yet to even come up with an effective vaccine. And then secondly, if you're not in one of those high-risk groups, you may not be getting vaccinated for another couple of years after that.
And my last question for you, doctor, is we hear a lot about the antibody testing. Is that reliable?
The fast answer to that is no, it's not. And that there are sites through the IDSA, the NIH, and the CDC that actually go over that, the pros and the cons of the test. and point out what the weaknesses and concerns are about it. It's something we'd like to have. The FDA approved many antibody testing very quickly at the beginning of the pandemic because of the emergency. They're now going back and decertifying tests that have not been found to be reliable. We're still trying to work out, not me personally, but the scientific community, exactly what the tests tell us, if they are protective, which is still a question for how long that lasts. So there's still a lot of questions around antibody testing, as opposed to the antigen testing, which is pretty reliable and sensitive and specific when done correctly. The antibody testing, we need more work on before it will become as reliable as the antigen testing is presently.
Great. Thank you so much for joining me this morning, Doctor. Is there anything else you wanted to make sure that we share with our community?
Just kind of a quick comment about vaccination. You mentioned vaccination. I hope when the vaccine becomes available that people will avail themselves of it. There was a lot of discussion. I know the discussion at the state capitol back before the pandemic about vaccination and should it be mandatory.
It's a very hot debate.
And that a world without vaccination is the world we've just gotten through living through. A world where people are not immune to a deadly disease. We all have to be afraid of each other breathing on ourselves or on others. We have to be locked up at home. The economy has to suffer. So I would hope that people take this time to reflect on the importance of vaccination. We'll get vaccinated when it becomes available. We've got other vaccines because this could have just as easily been an outbreak of measles or smallpox or chickenpox or whooping cough in an under-vaccinated population. So understand that we don't want to live in a world like this forever. And really the only tool we have when we have is vaccination. Otherwise, we have to live in the world we're now living in, which no one wants to live through any longer than we have to. So I would reflect on that as you're continuing to wash your hands, wear your masks, and stay 6 feet away from everyone.
Absolutely. Doctor, thank you so much for joining us. We really appreciate it, answering all those questions and sharing your insight with us. Be safe. Thank you.
You too. Bye-bye.
Bye-bye.